Hey guys, it's great to be with you again. I'm Dr. John Norian with HRC Fertility, and today I've got a wonderful guest, my friend, my colleague, a sperm, scrotum, testicle expert, Dr. Edmund Ko, Dr. Ed Ko, and he's from Loma. I'm going to let Ed. Why don't you introduce yourself a little bit? Just your academic background and sort of where you practice, things like that.
Sure, absolutely. Dr. Norian, thank you so much. It's an honor and pleasure to be able to join you on this video cast. I trained and did my residency at the Mayo Clinic in Arizona, and I did a male infertility and andrology fellowship at the Cleveland Clinic. I joined Loma Urology in 2011. I've been there for 9 years now. And actually, John, I think I met you to the ARM 2010 as a fellow. Somebody introduced me to you at the time, and they knew I'd come back to Loma, and we've been working together ever since. So I'm thrilled to be able to join you on this video cast.
Yeah, it was great. I remember when we met. God, 2010. I forget what city that was in. Maybe Denver or
it might
I
have
don't
been
know.
Denver. Yeah.
Yeah. All right. So, hey, Dr. Ko. So, Ed, what's the first step that you use to evaluate a guy's fertility? Like, what tests might you order? How do you talk to a guy just right off the bat? Hey, I've been trying 6 months, a year. How might you look into male fertility?
Yeah, that's a great question. I think oftentimes a lot of guys don't know where to start. They think maybe their partners are mainly at fault, and I think it's because women are more likely to seek medical help, but the guy is just as responsible for fertility as well. And so the first step I usually check is a couple of semen analyses, at least a couple of weeks apart. That gives us a window into what their fertility potential is. And then depending on what the semen analysis shows, I may or may not order some additional testing, including some blood work, sometimes a scrotal ultrasound. But usually the semen analysis is the start of the men's fertility evaluation.
Yeah. What do you look for in a sperm analysis? Like, if you could give your top 2 or 3 things that you look for in a sperm analysis, what are you looking for?
Yeah, so the first thing we have to see is whether there's sperm in there or not. Sperm
That's
is
true.
what causes the pregnancy, and so if they have sperm, that is a great start. Then we want to see what the quality of the sperm is. Is it moving? How does it look like? Because those things are going to be important in terms of causing a pregnancy as well. Some of the other things within the semen analysis that may not get as much attention, but still very important. One is the volume. If there's not enough fluid in there, even though you have a good count, you may not have that much sperm in there. So the volume is important. Same with the pH. All those things together can give us a little bit of insight into the men's fertility potential, but it doesn't always tell the complete picture.
Yeah, it's funny. I tell people I'm not a volume guy unless it's really low. So,
Yeah.
some guys come to me and they're like, oh, Dr. Norian, it's like 1.1, 1.2 milliliters. I'm like, I don't know. Am I wrong? Like, should I be more of a volume guy? When do you get excited about low volume?
Yeah, I think even if they're sitting at 1, I mean, the latest 2010 WHO guidelines dropped the normal volume from 2.0 down to 1.5. I really don't get too worried about it unless it drops below 1, because then they could have some other underlying medical problem like retrograde ejaculation, or maybe they may have an obstruction in their ejaculatory duct, and that may require some additional diagnostic testing. So usually not until it drops below 1.
Wait, retrograde. Are you taking me retro?
I
What's
am.
that? What's retrograde? That sounds interesting. I know
Yeah,
what
so
it is, but we're just
Yeah,
playing along.
so this is not like going back to the 80s or anything like that. We're not doing any sort of like a theme party, but retrograde ejaculation is exactly what it sounds like. Retro means going back. So normally when someone has an orgasm, all of the semen should go forward and out of the penis into the vagina. And so with retrograde ejaculation, part or all of it ends up going backwards instead. And so as you can imagine, if the sperm's not going forward and it's going backwards, it's very hard to cause a pregnancy. And when we evaluate these patients, sometimes we find out that they may have some sort of spinal issue going on, One of the things they're seeing a lot more with more guys being obese is diabetes. And oftentimes these guys don't even know they have it. And the first sign that they have is, hey, you know, my semen volume is dropping, or we get a semen analysis that has a very, very low volume. And then when I screen them for diabetes, we find it, and they find out they have a whole host of other medical issues going on. So,
Right, right. Yeah, the diabetes thing, it's a neuropathy, isn't that it? Like a diabetic neuropathy of
the
the
bladder neck.
sphincter that causes the sperm to go forward. We always get excited about diabetic neuropathies in our 60-year-olds
Yes.
who have tingling of their toes and, you know, things like that, bad blood supply to their distal appendages. But
Yeah.
isn't that the concept?
That is, you're absolutely correct. So there's a lot of nerves that are affected by poorly controlled diabetes or high blood sugars. And the nerves around the penis, as well as the bladder neck, which should normally close to allow all the semen to go forward rather than backwards, are no longer working as well. So in conjunction with the retrograde ejaculation or low semen output, we will have some guys that also end up having erectile dysfunction because of this as well, which if it's not getting hard enough, they can't get it up. It's very hard to have sex, therefore very hard to have kids.
Yeah. So it's not just ejaculating, but we need an erect penis, I guess you would say, to sort of do the deed.
That is correct.
What forming an erection, like how does that work biologically? Is that like is it difficult to form an erection? Do guys maintain to their erectile function as the years go on? When are men at peak fertility or peak erectile strength, I guess you might say? There's a lot of questions there, but talk to me about erections, Dr. Ko.
Yeah, so erections are very, very important. Now, you don't have to have an erection to have an orgasm, which is very interesting. But it does make it harder to do that because then the head of the penis is not going to be as sensitive. So peak erection is, it usually starts around kids and young adults in their 15, 16-year-old. And then it can actually go all the way until the 60s or 70s, but most guys in their 20s and 30s should be at their peak. And that's usually coinciding with the times when they're trying to actively have children. We do start seeing some erectile dysfunction in younger guys, especially with either hormone problems or even with fertility problems. I'll see a lot of guys with something called psychogenic erectile dysfunction, which is where there's not a hormone problem, there's a physical problem, they haven't had an injury, not any medications are causing it. But the stress of actually trying to have children and being on a timed intercourse regimen is quite stressful, and it can cause a lot of stress on the relationship. They can gain a lot of anxiety, and with those factors in play, it results in erectile dysfunction, which is really frustrating for them because before this event, they didn't have any problems. And so in those guys, I'll start them on some Viagra, and a lot of guys are like, well, isn't that for old guys? Like for my grandfather? Like, well, no, not exactly. I mean, what we're trying to do is just help you kind of get over this hump so that you can perform, have a child. And usually once they conceive, all of it goes away because the stressor then is removed.
Yeah, it's fascinating how that works. We see that with ovulation when in times of conflict, in times of war, in times of just stress, that women don't ovulate as well. So
that's
that
interesting.
from the male point of view, they just have problems sort of, performing in their own way. So,
yeah.
Hey, talk to me. Let's switch gears a little bit. Talk to me about what are some things that guys can do to improve their overall fertility. And you might even break it into a few different categories.
Yeah, no, that's a great question. Over the last decade, we've seen quite a decline in the overall semen analysis, semen quality, and then, men's fertility or infertility issues going up. And I think a lot of this has to do with changes in diet, changes in body habits, people just not taking care of themselves as well. And then also with a lot of environmental stressors and exposures. So as a whole, I think that one of the main concepts that I go back to, especially when trying to improve overall health, is if it's good for your heart, it's going to be good for your fertility. And what I mean by that? Well, for a lot of guys, if you're a little bit overweight, you're not exercising regularly, you're not getting regular sleep, you're under significant stress, you smoke a lot, your diet may not be the greatest. All those things can have a negative impact on your fertility. And if you take the steps to move away from that, so you start an exercise regimen, it may be something as simple as walking for 30 or 45 minutes a day and then slowly getting to a jog and then adding in weights and those kind of things. Changing your diet. There's been a lot of studies in the literature that show that a Mediterranean type diet that is, less of the saturated fats, more of the legumes, things like lentils, those kind of things, more vegetable based, plant based, and then improving those things and trying to move away from smoking, for example, and other exposures. All those things have a way of improving men's overall fertility and their semen analysis. Now, it doesn't mean that if you do all those things that things are going to correct themselves. That may not happen, but at least it moves you in the right direction. So the key concept here is if it's good for your heart, it's going to be good for your fertility.
Well said, well said. Also better for your erections, right? I mean, eating healthy, correct. Exercising, guys are going to perform better sexually.
Yes, no, you're absolutely correct. So with the epidemic of male obesity, that has really affected the hormones in a lot of guys. If you're carrying extra weight, your testosterone levels are going to be lower. And your estrogen levels are going to be higher. This can directly affect your ability to get and achieve and maintain erections. And so when you correct for the weight and the extra fat, oftentimes your hormone levels also improve. And secondarily, your fertility improves.
Yeah. One of the other things I just want to sort of highlight, again, guys, just to reintroduce ourselves, I'm John Norian, Dr. Norian, and this is Dr. Ed Ko with Loma University Health, Department of Urology. He's a fertility specialist. Sort of brings me back to Loma Linda a little bit. And for those who aren't aware, Loma Linda's, the city of Loma Linda is a blue zone. So blue zones are these amazing places in the world where people live like at a much higher level to like into their hundreds, 110s. I mean, it's crazy. And people try to figure out reasons for this, like Okinawa, Japan, Crete, Loma Linda. And a lot of it gets to diet and also, my understanding, to relationships. And one of the things during this pandemic, people talk about gaining weight, about COVID weight. People are more isolated. People are, just living with a smaller group of people. And those things themselves, I bet you, are not great for male fertility. So I don't know, maybe you can comment on male fertility and life in a blue zone.
Yeah. I think that there's kind of two main factors that go with that. I mean, relationships are definitely very, very important. And that's kind of like the foundation of fertility, right? If you don't have a partner relationship, it's kind of hard to have kids. But yeah, the mental health aspect of COVID-19 and not being able to commune with people on a regular basis has definitely taken a major toll. As to its exact kind of effects on male fertility, I think that's going to be a lot harder to parse out. I mean, we'll probably see the after effects of this after the pandemic is over in the next couple of years, when people are going to try to have kids again, and we may see some major changes. So I think that's a hard question to answer. I think
I got it.
the weight part of it and the dietary changes and maybe the lack of exercise because of the stress, I think that's definitely going to have a negative impact on male fertility. There's just so many unknowns at this time.
Let's do some rapid fire questions. How about that?
Absolutely. I'd love to.
Can guys cause miscarriage?
They potentially
so why? Would you order one test?
Yeah. So I think that, it takes two to tango, right? So I think one of the things that we don't check as much is a sperm DNA. And DNA fragmentation is something, if a couple has had one or two miscarriages, that I encourage that Because the semen analysis, although it is a good look, like a window into male fertility, it doesn't tell the whole story. And there's something going on under the hood of the sperm, if you will. And that's where DNA fragmentation comes into play, where we can actually look at the DNA, the quality, and see how good is it. And if there's a significant amount of DNA fragmentation or reactive oxygen species that are present, the risk for miscarriage definitely goes up. And that's from the man side.
Got it. Hey, blood in my ejaculate. Should I be worried?
It can be a sign for an underlying infection. Most of the time, if we treat it with a course of antibiotics, it's going to go away. 99 out of 100 times, if we evaluate someone fully for blood in the ejaculate, we're probably not going to find anything. In very rare instances, if a gentleman is older, sometimes we can find a cancer that's there. Most of the time, we're looking at an infection that could potentially cause that.
It's sore down there, Dr. Ko. Should I be worried? What should I do?
Yeah, so it depends on whether it's on the penis or the testicles. Certainly, if it's in the testicles, and I think an ultrasound is reasonable, you definitely want to get it checked out. We never discount a man who has pain down there because it could be a sign of something more serious going on. There are studies that demonstrate that men who have fertility issues have a 3-time higher risk of having testicular cancer. So, I mean, here's a public service announcement. If you're a guy and you're listening onto this, or you have you're a female and you have a male partner that's having some problems, definitely check yourself on a regular basis. Check your testicles. Women always hear about checking their breasts on a regular basis for breast cancer, breast lumps. But for guys, you definitely got to reach on there and check on a regular basis. Best place to check: warm shower, hot tub, wherever you're at where it's warm and your scrotum's nice and loose. Check down there. If it doesn't feel like a smooth grape, and you feel something hard or lumpy down there, go see your doctor.
Got it. That's helpful. Hey, this is a little bit of a sort of awkward discussion, even for a little bit me to bring up, but fertility in the modern age, so many of us, we all have these darn smartphones. Have things changed? Like, has your practice changed? Like the age of your patients and like over recent years? I don't know. Talk to me about like pornography. Oh my God. In male fertility. I mean, do they go together? Is it a good thing?
Yeah. Pornography has always been a kind of sticky subject for a lot of people. As to whether it affects the semen analysis or fertility, I don't know if it does, but I've started to see a lot more men who have problems with erectile dysfunction in their relationships, especially when they use pornography quite a bit. I think that it sets a unrealistic ideal and expectation for them and their partners, and oftentimes their partners, they're human, and they can't meet that expectation, and because of that, it adds quite a bit of stress to the relationship and can result in erectile dysfunction. So oftentimes I'll just tell guys, look, you got to back off a little bit. A lot of times the pornography is also related with masturbation. I think masturbation is healthy, but if done in excess, it can certainly have a negative impact on the relationship and potentially on the fertility as well.
Got it. Yeah, I mean, I remember hearing someone. I actually was at a national meeting when this came up. I mean, it was pretty boring. We were at a convention center, and it was a darkened room watching PowerPoint slides, and they brought up the point of the guys in these videos and the women. They're actors. I mean, and they're like well-paid actors. I mean, it's like a professional baseball player. So
Sure.
Then you have John Doe, Jane Doe, whatever fertility person. And, they're not paid actors.
Right.
So it's a hard standard to live up to, sort of exactly what you were saying.
Absolutely. I mean, you would never look and say, I'm going to compare myself to Hugh Jackman or Ryan Reynolds, right? I would never look at it and say, I'm going to compare myself to Jackie Chan or Bruce Lee. Those are paid actors. That's what they do professionally. And so you're absolutely correct. If you are comparing your sex life and what your partner should be like, compared to a porn video that you've seen, I think that's a little disingenuous and unfortunate.
Oh my God. Yeah. All right. Okay. So, hey, let's start wrapping it up. What are some of the things that you have been talking to most? Like when you evaluate a male, what are some of the key things like that you want to leave your male partners with?
Absolutely. I want to give them reassurance that there's something that we can do. I think that, it takes a lot to get a man to a doctor. Most men, like myself, I don't like going to a doctor. I don't like taking pills. I just want to assume that everything's going to be okay. And if I deal with it, it's probably going to fix itself. But, male fertility, in couples that have fertility issues, the man is involved in 50% of the time. And that's where we come in. I think that if we can reassure the male as well as their female partner that, hey, look, we're going to work this out as a team. We have a good working relationship and we're going to work you both out. And hopefully we can find a solution for the problem. That's what I want to provide for these males, because they're already on edge when they come through my door and they sit down and they're stressed and they think, oh man, maybe it's all my fault. But it's not. It's half and half, because it does take two to have a family and to start a family. And so we're not there to throw stones. We're just trying to do some fact finding and hopefully find a solution for the problem that they have.
Got it. That's great, Ed. Dr. Ko, hey, I'd love to have you back on because I want to talk about things like vasectomy reversals, Clomid, anastrozole, HCG. There's so much more to talk about, but I think that let's leave it to another day.
Absolutely.
And, I hope that everyone has a good holiday season and, stay well, stay safe. And maybe you could just reintroduce yourself. I'm Dr. John Norian with HRC Fertility. And my guest today is Dr. Ed Ko. So Ed, maybe you can sign off yourself.
Sure thing. My name is Dr. Ed Ko. I'm with Loma Urology. I treat male infertility there. Thank you so much for allowing me to join you on your video cast today. It's been a pleasure and an honor, and I look forward to future sessions.